Yes, come in.
Hi, how are you doing today?
I'm fine. How you doing?
I'm good. Do you mind if I close the door to give you some privacy?
That's fine.
Okay. I'm going to go ahead and sterilize my hands. My name is Nurse Robinson. I am going to be your nurse today. Would you mind giving me your name and date of birth, please?
Anthony Robinson, 11283.
Okay. And Mr. Robinson, do you know where you are today?
Yes, I'm at the clinic.
Okay. And do you know today's day?
Yes, it's Saturday.
And the year?
It's 2020.
Okay. And the reason for your visit?
To get a checkup.
Alright, so if you wouldn't mind, could you just please place your hands like this for me? We're going to do the Fallon's test. You're going to have your hands placed in that position for 60 seconds, and I'm going to ask you a few questions, okay?
Okay.
Alright, are you in any pain today?
No.
Do you have a cough?
No.
Do you have any history of TB?
No.
Respiratory infection?
No.
Any history of pneumonia?
No.
Okay, and have you had the flu shot this year?
No.
Have you had the pneumonia vaccine this year?
No.
Okay. All right, and I don't note for you to be in any respiratory distress, and I do not see any retraction of the chest. Do you feel any numbness or tingling in your hands?
No.
Okay, so if you wouldn't mind placing your hands out like this for me, I'm going to go ahead and I'm going to do the Tenille test. And I'm just going to be tapping here. Do you feel any numbness or tingling?
No.
Okay. You go ahead and pull your hands over like this. I'm going to check for any crepitus in your hands, any swelling, discoloration, which I don't note any crepitus or discoloration. I don't see any swelling or anything in your hands or in your fingers. I'm going to check for capillary refill. Capillary refill is brisk, less than 2 seconds, and I see that you are alert and oriented ×4. You can go ahead and place your hands down for me. What I'm going to do next is I'm going to inspect your face, your head, and your ears. Your skin color is appropriate to ethnicity. I do not see any bruising or discoloration or any lesions on your face. Skin integrity is intact, as well as on your scalp. I do see skin integrity is intact. Your ears are symmetrical to your face, as well as your eyes. I note that your nose is in the middle of your face, and I do not see any cyanosis or bluing of your lips. Next, I'm going to go ahead and I'm going to palpate your scalp. And what I'm doing is checking for any swelling or any edema. Is there any tenderness, any pain, or any discomfort when I do that?
No.
Okay. So what I'm also going to do is check your temporal artery. We're going to do your temporal pulse, as well as your sinuses. Is there any pressure here?
No.
Okay. How's your maxillary sinus? Any pressure here?
No.
Okay, and that is your frontal sinus. Good job. Okay, so the next thing I'm going to do is I'm going to be going over all of your lymph nodes. This is preauricular, postauricular, occipital, okay, submantle, and submandibular. Okay. All right, so I'm also going to do your jugular digastric, your anterior cervical, as well as your posterior cervical, and your deep cervical chain. And do the same thing on this side. I'm going to go over your anterior and your posterior cervical. I'm going to do your jugular digastric and your deep cervical chain. Is there any pain or tenderness when I do that?
No.
Okay. If you wouldn't mind, go ahead and shrugging your shoulders for me. All right. I'm testing here for your supraclavicular. Go ahead and relax your shoulders. Now I'm just going to pinch a little bit of your skin, do skin trigger. And I don't note any tenting, so that is good. All right, so Mr. Robinson, the next thing that we're going to do is we're going to go over your cranial nerves. You have 12 cranial nerves that we're going to be going over today. And first I'm going to inspect your neck, and I don't see any swelling or bruising or discoloration or anything over your neck. I'm also going to check for bruising. So I'm going to use my stethoscope, and I'm going to use the bell side. And I want you to just breathe normal. And then I want you to inhale, exhale, and hold. Okay, you ready? Inhale, exhale, and hold. Okay, then do the other side. Go ahead and relax and breathe. All right, and then I want you to inhale, exhale, and hold. All right, we're doing the angle of the neck, your mid-neck, and then the base of the neck. Okay, great job. I don't note any brooding there, so that is good. Next thing I'm going to do is I'm going to go behind you. You should turn the other way. No, you gotta turn that way so we can see.
This way?
Yeah.
Okay.
Okay, I'm going to palpate. I'm checking your thyroid. And I'm going to push to one side, and I want you to swallow. Okay, good. And push to the other side, and I want you to swallow. Okay, good. So while I'm here, I'm going to go ahead and I'm going to inspect your back. The skin integrity is intact. I don't note any discoloration, any bruising, lesions, or swelling of your skin. So everything there appears to be good. What I'm going to start off with is some chest expansion. So go ahead and breathe in and out for me. Okay, good. And then I'm going to feel for crepitus. I don't feel any crepitus. And next I want you to just say 99 when I place my hands on your back, okay?
Okay. 99, 99, 99, 99.
Okay, good. And I was checking for tactile firmness. Next I'm going to do CVA tenderness. Any tenderness there?
No.
Okay. And any tenderness there?
No.
Okay, good job. So what I want to do next is I'm going to percuss. Okay, and then I'm going to auscultate.
That's fine.
And this is beginning with C7. I'm going to listen for some lung sounds. Just go ahead and breathe normal. All right, so your lungs sounds good. They sound clear bilaterally. You can go ahead and turn around to the front for me. Okay, so the next thing I'm going to do is I'm going to be inspecting the skin in the front of you, and everything in the front seems to be symmetrical. There's no skin lesions or bruising or any discoloration of your skin, and the skin integrity is intact. I'm going to check to make sure your trachea is midline, which it is, so that's good. And then I'm also going to do some chest expansions in the front, so go ahead and breathe in and out for me. Okay, and then I'm going to check for tactile firmness as well as in the front, so go ahead and say 99,
99, 99, 99, 99.
okay. and there seems to be no increase of tactile firmness. Now I'm not going to percuss, but I am going to auscultate. So I'm going to listen to your lungs. Okay, good. And your lungs, they sound good. They sound clear bilaterally there as well. So now we're going to start to work on your cranial nerves. We're going to begin with cranial nerve number 1, which is going to be going over your sense of smell. As I stated before, your nose does appear to be midline in the center of your face. I don't see any discoloration or any bruising or swelling on your nose. I don't note any drainage coming from your nostrils neither. If you wouldn't mind putting your hand over your nose, please. Is there any tenderness or any pain felt around your nose?
No.
Okay, go ahead and cover one ear for me. Breathe in, breathe out. Go ahead and do the same side on the other one. Okay, just checking for any occlusion. Is there any problems or issues with you breathing or any pain or discomfort?
No.
Okay, so now I'm going to check the inside of your nose. Your mucosa's membrane is intact. It's nice, light and pink. I don't see any drainage or buildup, and your septum does not appear to be deviated. So the next thing I want to do is perform a smell test on you. So if you wouldn't mind closing your eyes, I'm going to give you something to smell. I want you to cover one ear, and when you smell, I want you to tell me what it is that you smell. Smell. What do you smell?
Alcohol.
Okay, go ahead and cover up the other side for me. All right, smell. What do you smell?
Same thing, rubbing alcohol.
Okay, good job. Okay, so cranial nerve number 1 is well intact. We're going to go over cranial nerve number 2, which has to deal with your vision. We performed your Snellen chart earlier and concluded that your vision was at a 20/20, so that is good. The next thing that we have to do is do your Jaeger card. So I'm just going to give you something to read, and I want you to tell me what it is that you read. We're going to hold this out about 14 feet in front of you. Go ahead and hold this here, and I want you to tell me what it is that you read.
Walter Mosley, Blue Light.
Okay, great job. Put that back over here. All right, so now we're going to go ahead and move on to cranial nerve 3, 4, and 6, which is going to go over your pupils. So I'm going to check your conjunctiva and check your lower lids as well as your upper lids. And your conjunctiva is nice and pink. I don't see any scars or lesions there. Go ahead and look up for me. Your sclera is nice and white. There is a little veining, which is normal. Go ahead and look down. Same thing, conjunctiva, nice and pink. And there's no discoloration on your sclera. It is nice and white with a little veining. Along with this, I am going to check your pupil gauge. Your resting pupil, I know, is about a 4. So what I'm going to do is I'm going to shine a light in your eye. I'm going to check your constriction. Just go ahead and look straight at me. Okay. All right, good job. I know that your pupil goes down from a 3 to a 4 for constriction. Next thing that I want to do is we're going to be checking with your vision using my finger. I don't want you to move your head at all. Just follow my finger everywhere my finger goes. Okay, good job. Now keep looking at my finger as I bring it into your nose. And back out. Okay, good job. Oops, sorry. Alright, so everything there checks out. I do not note any abnormalities or anything which your eyes or your cranial nerves 3, 4, and 6. I note that your pupils are equal and responsive and reactive to light, and they also accommodate. The next thing we're going to do is go over cranial nerve number 5, and we're going to be testing with some sensation on your face. So I'm going to rub something on your face. You go ahead and close your eyes and just tell me when you feel it.
I feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, good job. Now the next thing I want to do is test for TMJ. I'm going to place my hands right here in your joint. I want you to open your mouth, close, bite down, open your mouth, stick your tongue out from side to side. Okay, good job. So I do not note any crepitus there. Was there any sort of pain or discomfort or anything that you felt when I did that?
No, ma'am.
Okay, so we're going to also check cranial nerve number 7, which is going to be your facial movement. So I'm going to have you do some facial movements for me to make sure that that cranial nerve is intact. If you wouldn't mind smiling for me. Okay, doing kissy lips. Raise your eyebrows. All right, now puff up some air in your cheeks. Okay, and I do note that the air in your cheeks are released bilaterally equally. So that is good. The next thing I want you to do is we're going to go over cranial nerve number 8, which is going to be dealing with your ears. So like I noted before, I do not see any discoloration in either of your ears, and they do appear to be symmetrical, and I don't note any draining in your ears or discoloration. I do see that you do have a piercing bilaterally on both right and left earlobes. So the next thing I'm going to do is I'm going to check inside of your ear. Okay, I'm going to use my otoscope, and I'm going to turn it upside down, and I'm going to be checking inside of your ears. I'm going to pull your pinna up and back. I don't see any excess buildup of cerumen. There doesn't appear to be any blockage in your ear. And I do note your tympanic membrane is a nice clear pearly gray color. Going to do the same thing on this side and inspect your ear. Do not note any excess buildup of cerumen. I don't see any discoloration, any blockage, or any lesions of your ear. And the tympanic membrane on that side is also a pearly gray color. Now I do note that your cone of light on your left ear is at 7 o'clock and on your right ear is at 5 o'clock, so that is good. The next thing I want to do is the whisper test. So I want you to place one finger over your tragus, and I just want you to move it around in a circular motion. I'm going to say a sequence of numbers or letters, and you're just going to say what it is that you heard me say, okay? All right, I'm going to stand over here.
1AB.
Okay, good job. Go ahead and do the same thing on the other side. I'm going to stand over here.
2CD.
Okay, good job. All right, so everything there for your cranial nerve number 8 checks out. So we're going to move right along to cranial nerves 9, 10, and 12. These cranial nerves is going to be dealing with your mouth. So I'm going to inspect your mouth along with your lips and your teeth. So as I've noted before, there is no cyanosis of the lips. I do not note any other form of discoloration. There's no lesion or bruising. The lips do not appear to be chapped. If you wouldn't mind, go ahead and open up your mouth for me. All right, so because this membrane is nice and pink, I do note that you have some minor dental work performed. I see the roof of your mouth. Your hard palate and soft palate are both intact. I do not note any lesions there. Stick your tongue out for me. Your tongue is nice and pink. Go ahead and then Go ahead and say ah. Okay. I would grade your tonsils at about a 2, so that is good. And I note that your uvula is midline in the center of your mouth. Next thing I'm going to do is the gag test. So if you go ahead and open your mouth for me, please.
Okay.
Okay. All right. Good job. Sorry, I hope that wasn't too bad.
No.
All right. So everything there checks out. We're going to go ahead and do your cranial nerve number 11. This also works in with your range of motion, but while we're going over your cranial nerves, we'll go ahead and test for that. So what I want to do is I'm going to place my hand here. I want you to try to turn your face towards me. Okay. And then place my hand here. And I want you to try to turn your face towards me. Okay. And go ahead and shrug your shoulders. Relax. Okay, now shrug your shoulders again. Okay. All right, so everything there checks out and appears to be nice and normal there too. The next thing I want to move on is I'm going to have you lay back on the bed. And we're going to place the bed at a 40-degree angle, and I'm also going to remove the pillow. Okay. All right, I'm going to get my ruler and we're going to check for jugular distension. All right. So I'm going to place my ruler right at the angle of Louis. Go ahead and lay back for me. Okay, get my straight edge. Centimeter side. And turn your head a little bit for me. We're going to test your jugular vein. Okay, and I note this is at 1.5 centimeters, so you would be negative for jugular distension. Go ahead and prop up some more pillows for you. Is that better?
Mm-hmm.
Okay. All right, so the next thing I'm going to do is I'm inspecting your chest. On your chest, I do not see any discoloration or anything. I do not note any lifts or heaves in your chest, so that is good. I'm also going to be palpating, and I'm going to palpate your external border and the base of your heart and the apex of your heart. Okay, good. Everything there checks out and appears to be normal. So I'm also going to check for PMI. I'm going to locate the 5th intercostal midclavicular. And check for PMI. Okay, good. So everything there checks out normally as well. The next thing that I am going to do is I'm going to be percussing, and I'm going to percuss in several areas. Well, I'm going to start at your anterior axillary line. So I'm going to start right over here. Okay, and I note that your resonant, your sound changed from resonant to cardiac, which is good because that is where your heart is located. So the next thing I'm going to do is I'm going to be doing some auscultation, and I'm going to be listening to some heart sounds, some S1 and S2. All right, let me find the area first. We're going to come down from your manubrium to your right intercostal space and locate your second intercostal space. All right. So I'm going to be listening to your aortic valve, and then your pulmonic valve, and S1 and S2 is heard. We're going to go down to your third intercostal space, which is Erb's point. And then we're going to go to your fourth intercostal space, listen to your tricuspid valve. Both S1 and S2 sounds were heard. Then I'm going to go to your fifth intercostal space, mid-clavicular line, and listen to your mitral valve. Okay, so then I'm going to turn over to the bell side and listen. I'm going to listen here for 1 minute. Okay, great. So your heart rate was normal. It was at a rate of 65. So that is perfect. Next thing I'm going to do is I'm going to inspect your abdomen. Your abdomen is nice and round. I see your skin integrity is intact. I don't note any discoloration, any bruising, or lesions on your stomach. Okay, so I'm going to also listen for in your stomach for some active bowel sounds. We're going to listen in your right upper quadrant, your left upper quadrant, left lower quadrant, right lower quadrant. Okay, good. Active bowel sounds were heard ×4. So I'm also going to percuss in your abdomen as well. Okay. Was there any pain or discomfort or anything there?
No.
All right. So just so you know, a few things that are located inside of your abdomen area. You would have your cecum, and then which would be in your right lower quadrant, and then you'd have your ascending colon. There would be your gallbladder and your liver. As we move over here, there's going to be your spleen. Then there's going to be your descending colon, and then in your left lower quadrant there'll be your sigmoid colon, and your bladder would be located in the middle. So I'm also going to do some palpations. I'm going to do deep and light palpations. So we're going to start off with some light palpating. Is there any pain or discomfort while I'm doing this?
No.
Okay. Now we're going to do deep palpations. Do you feel any tenderness, any pain, or any discomfort?
No.
Okay. So now we're going to listen for some cardiac sounds. This is where your aorta would be. Your iliac on the right, iliac on the left. Your renal on the right and renal on the left. And then we would come to your iliac. Okay, and then as we move down lower, it'll be your femoral on both your right and your left side. So everything there checks out good. Everything sounds to be normal. I don't know any disformities or abnormalities or anything there. So what we're going to do now is we're going to move on down towards your legs. Okay, so I know the temperature on your skin is nice and warm. Skin integrity is intact. I didn't see any discoloration or anything of your skin. I'm going to remove your socks if you don't mind. Just place them over here. I don't note any edema. There's no pain or swelling. Capillary refills bilaterally are brisk, less than 2 seconds. I'm going to test for your pulse, your dorsal pedis pulse. I know that is a 2+, along with your posterior tibial pulse. It's 2+ bilaterally as well. I don't see any bruising and I don't feel any crepitus in your feet as all. So we're also going to do some range of motion. If you don't mind, could you flex your toes for me? Like, could you bring them out and extend them back? Okay, open your toes, bring your toes back together. Some abduction and adduction. If you go ahead and bring your heels inward for me. Okay, and then bring them back out. Okay, we're going to do this inversion and exversion. Test for your strength. I want you to pull your feet up towards you. Good job, and push your feet back down. Good job. Okay, your strength is a 5 out of 5, so that is good. Next thing I'm going to do is I'm going to have you sit down, and I'm going to check your tendon reflexes. So if you go ahead and come back down to the edge of the bed for me. Okay, go ahead and relax your arm. We're going to do your bicep tendon. Okay, go ahead and relax your arm like this. We're going to do your tricep tendon. Okay, same thing on this side. Go ahead, relax your arm. All right, and do your tricep tendon. Okay, now we're going to do your patella and your Achilles. Okay, you do it right here on your knee. Okay, and the other side. All right, now I'm going to do your Achilles. Go right behind your ankle. Okay, next side. Okay, good. All right, so your bicep tendons check out. All right, so then I want you to go ahead and stand up. All right, I want you to rotate your neck for me. Move your neck side to side. Turn like this, side to side. Okay, move your neck up and down. Go ahead and flex your shoulders. Bring them all the way out. Extend your shoulders, bring them back down. Hyperextend your shoulders, bring them towards your back. And then I want you to, we're going to do some abduction and adduction. Go ahead and move your arms out. Moving back in. Okay, good job. So then I want you to also do some internal and external rotation. Take your arms and put them behind your back. Okay, and take your arms and put them behind your head. Good job. And then we're going to do some circumduction. So go ahead and swing your arms as if you were like swimming. All right, the next thing I want you to do is go ahead and bend over. I'm going to check for any curvature in your back. And I'm going to check for scoliosis. Good. You touching your toes?
Yes.
Okay. Good job. I don't see anything abnormal there. All right. So the next thing I want you to do is bend straight back for me. Okay. And we're going to do some rotation. Can you put your hands on your hips until you turn side to side? Okay, so we're going to do some lateral flexion. I want you to lean toward your left and your right. Okay, good job. We're going to flex your elbows. Go ahead and extend your elbows out. Okay, extend them straight out in front of you. And then hyperextension, move them all the way towards the back. Or move them down to your sides like you're locking your elbows. Okay, good job. And then I'm going to test the strength in your arms. So I want you to go ahead and flex your elbows for me again. All right, and I want you to try and pull against me. Okay, don't let me knock you over. Okay, all right, your strength there is a 5 out of 5. We're gonna do some range of motion in your wrist, so go ahead and hold your hands out. All right, turn your hand inwards and outwards. That's ulnar and radial deviation. And I want you to put your hands up, down, put your hands back up, flex them all the way back. All right, so that's some extension and hyperextension of your hands. Now we're gonna do some range of motions in your fingers. Go ahead and spread your fingers out. Do some abduction and abduction. Spread them out. Bring them back in. Hold your hand up like this. Down. Okay, now I'm gonna give you my hand. I want you to grip around it. Okay, this is testing your grip. All right, go ahead and do it again. All right, don't let me pull or push against you. Okay, good job there. All right, so everything there checks out. We're going to do some range of motion in your hips. Go ahead and just stand up straight, and I want you to bend back for me. Okay, bend a little bit forwards. All right, raise your knee up. Okay, move your knee outwards. Raise your knee back up. And move it outwards. Like out. Okay, and then bring it back in. Okay, good job. And then I want you to just rotate your hips. Okay, like you're doing a hula hoop. All right, so the next thing I'm going to do is I'm going to test your gait, and I want you to do some walk for me. So I'm going to have you walk normal. So just go ahead and walk straight down there and walk normal for me. Walk back to me. Okay, walk down there on your heels. Okay, walk on your tippy toes coming back. Okay, and then walk heel to toe. Okay, so everything there checks out. Everything seems to appear to be normal. Did you have any questions or anything for me?
No.
All right, so if you don't mind, go ahead, have a seat. I'm going to go ahead and clean my hands, and I'm going to step out, and the doctor will be right in with you.
All right.
All right, thank you.